and some of these are sensed and then tracked to the ventricle, resulting in ventricular pacing. So what's happening is atrial oversensing, which results in unnecessary RV pacing. And if we look at the underlying rhythm by turning off pacing altogether, we see that there is sinus bradycardia with prolonged QRS duration, and still we see a lot of atrial noise. And so the patient basically has sick sinus syndrome with a regular stable sinus rhythm with bradycardia. Now if we do AO pacing to see what is the atrial pacing, we find that the atrial pacing in fact remains intact, though there is oversensing. But if we turn off sensing, the atrial pacing is very good with intact AV conduction, resulting in A-paced and V-sense rhythm. And the reason was that the patient had an atrial lead which was pulled up and was causing a lot of atrial oversensing. Now what to do next? Now the simplest solution would be to reposition the atrial lead or put a new atrial lead in fact, but the device still has a battery life of 1 year and the patient is not willing to get it changed right now because of financial issues. The other option is to let it remain as it is and let him continue with his symptoms related to sinus node dysfunction, which are basically palpitations due to ventricular pacing in response